Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar with another episode of High Yield Pediatrics. And today's topic is very critical topic in the development of our teenagers and our children. And it is on depression and suicide, more common in teenage. And by an estimate, up to 10% of teenagers may be depressed at some point during a month's time. And this depression in teenagers is more common in females. And this depression, which is common in the teen years of 15 to 19 years, can ultimately lead to self-destruction or suicide. So the parents and the pediatricians have to be very alert on the signs of depression, which could ultimately lead to suicidal behavior. Risk factors could be little conflicts in the family, with the siblings, with the parent, with the cousin, someone they had conflicts and that is not in their control, and they get upset and want to take their life. Substance abuse, which is a very common problem in the developed world as well as the underdeveloped world, marijuana, heroin, morphine, recreational drugs, which are available to kids or they can get from other people, can really depress their mood. As a withdrawal, they could become suicidal. Or as a guilt of using those medications when they see that they're dependent on them, they're having withdrawal symptoms, and they can consider taking their life. Significant loss of a loved one like parent, very close friend, grandparent, they can really make them depressed and take their behavior towards suicide. And sometimes friends, they learn from their other friends. Someone in the school had done that, so they take it as a role model and they may want to do the same thing. And it's kind of an escape from the worldly problems, because during this age, although they're big and tall like their parents, but they are not mentally mature, so their delicate minds cannot handle the stress and pressure and can lead to suicidal behavior. Parental separation, divorce is another big risk factor, which can alter the lives of teenagers and can affect their behavior. If they are not doing well at school, people who are dropping out of the high school, people who have failed an exam, people who have not achieved what they want to be. Sometimes, back in medical school, if someone would fail a professional, people have taken their lives. People who have failed to qualify for a medical school or failed to qualify for any other professional training institute can lead to fatal suicidal behavior because they cannot accept failure. And then when they are reprimanded by their parents and family, that really puts them down, and that snowball effect of depression can lead to the suicidal behavior. Kids who have had significant physical or sexual abuse are again at risk of depression, which can lead to ultimately suicidal behavior. Some families have depression, so the physician who is their primary care physician should identify if there is any psychiatric illness in the family, any history of depression, any suicidal attempts in the parents can be a red flag for that child or teenager. And if the teenager has done a previous suicidal attempt, which was of course failed attempt, then they are highly susceptible of doing that again. So making sure that they have all the resources to cope with this problem can really help. Chronic illnesses, they have had new diagnoses like diabetes, like asthma, cystic fibrosis, cancer. So kids or teenagers cannot deal with lifelong illness diagnosis, and they may want to take an adverse reaction. The signs of depressed mood include, they start missing their school, so teachers have to be alert and parents have to be alert if they get a call that your child is not coming to the school, they are not doing well at school, they're not showing interest in activities that they love to do, like jogging, playing, watching TV. Those pleasurable things that they used to do are no longer pleasurable. They want to stay alone, they talk less, they are withdrawn, or they have started to smoke or use illicit drugs. It can be a big sign of depression and suicidal behavior. Physically, you can see a slew of symptoms. They may be tired, headache, poor grooming, not taking showers, not changing their clothes, losing weight, undereating, or sometimes overeating, loss of self-esteem, and feeling worthless, not feeling pretty. The girls don't feel pretty, they don't feel that they're good, they start eating less, they start losing weight excessively, and sometimes binge eating can happen. So all those red flags, the parents, the teachers, the family have to identify these kinds of signs. Or if they are really, really very sad, they are hopeless, they have low esteem, they criticize at themselves, they feel worthless, they feel that they are not pretty. All these things are signs of depressed mood, and these depressed mood can lead to suicidal behavior. That's why sometimes universal screening of these symptoms, like depressed mood, loss of interest, weight loss or gain, lack of sleep or oversleeping, agitated feeling, fatigue, loss of energy, feeling worthlessness, or excessive or inappropriate guilt if they have for some reason, ability to think or perform their tasks, not be able to do the homework, not pass exams, and recurrent thoughts of death or suicide, suicidal attempts. All these things are very, very, very vital that they should be identified in a timely manner, and the child should be put in counseling, so that the psychological assessment can be done, the psych counseling is carried out, and if child qualifies, should be on treatment, should be in behavioral therapy. Sometimes there are anti-suicide programs. The parents have to support, the teachers, the family, so everyone has to be supportive, so that the behavior towards self-destruction and suicide does not take place. And if they need medications for depression, the taboo in our societies that if they will go to a psychiatrist or psychologist should be discouraged. Mental illnesses like depression has definite pathophysiology. It could be inherited, it could be an alteration in their neurotransmitters, the chemicals in the brain, and they have to be restored by antidepressants. Those could be prescribed by the psychiatrist to treat their depression, and the parents should encourage counseling, supervise their kids, support them physically, not over criticize them. Family therapy, behavioral therapy, all these techniques will help. But the most important part of it is recognition and being alert, on a lookout of the signs. If there are other family members, people in their basketball, their soccer team who have done suicide, sometimes multiple members of the team can do the same thing. If they're bullied in the school, so you have to ask your kids if they are excessively bullied. Cyberbullying is another important problem in today's world, in which kids could be criticized on the way they look, on the way they dress, their language, their culture, their ethnicity. There's so many other cyberbullying things which are being done, and a lot of people have self-harmed because of the cyberbullying. So it has to be very, very, very important aspect of our teenage development, that their mood should be recognized, and parents are the most important part of this support system, as well as the psychologist, the social worker, the psychiatrist, and the regular doctor has to work with the child. And these days hospitals ask about child having thoughts of hurting themselves, thinking if they would rather be dead, feelings of self-reproach, guilt, having a plans for the suicide. All these are red flags that are identified in the hospitals, and proper counseling and management is carried out. So I hope this video was useful. It is very important for all ethnicities to understand the problem of depression and suicide in the teenagers, in young adults, which is prevalent and is kind of rising. So parents have to play their role, identify, don't be too distant from their teenagers. A lot of time introvert teenagers may not may not be telling what they're feeling, so may not explain what's going on with them. So the parents have to pick the signs that my child is not taking shower, is not changing clothes, is not enjoying being outside, is missing school, the school performance is going down, is not eating well, is losing weight. Let's do something about our child before it gets too late. So please identify these psychological and psychiatric problems before it's too late. Hopefully these problems could be identified, and may God protect our children and our families from the problems of depression and suicide. As Muslims, and most religions discourage suicidal behavior. So we have to tell our kids that they're really, really very important to us, and express our loves for our kids by giving them time, taking them for a walk, understanding their teenage issues, sharing their problems, supporting them, and encouraging them to do the right thing, and praising their good behavior, praising the way they look, praising the way they dress up, even if they have not achieved great in their school, still praising them, not demanding them that they should be straight A's, because that can overburden them, make them depressed, and make them suicidal. Hopefully this video would have had some addition to your knowledge, and please like and share this video and subscribe to my channel. May God bless us and our families. Sallallahu alaihi wa alihi wa sahbihi wa sallam. Thank you.